And of course, occasionally we see bone cancer, but I just can't believe a dog 3 years of age would have bone cancer. But actually, I had one. It turned out not to be such a happy one, but a 3-year-old golden retriever. Again, this is a relatively young dog. Came in limping, and it had been going on for 3 or 4 weeks. You know, usually if it's a sprain or strain or something of that sort, after 2 or 3 days, if the pet is kind of kept rested or quiet. And that's why I want to point out to all the viewers or listeners is that so often people come in, the dog is limping, but I think you have to make an effort to keep the dog quiet because the dog's pain threshold, I think, is a little bit heavier or higher than ours, or they just their body pays less attention to pain.
Mm-hmm.
But a lot of times, if they're sprained or strained, they'll keep running around, and it just aggravates the injury. So I just encourage people that a simple thing they could do at home is for a day or two, if the dog doesn't seem to be in severe pain, is just try to restrict the animal. You know, walk outside on a leash and collar, potty and back in. Don't take it for the 10-mile walk or, something long. Just kind of rest it. And in many cases, that's enough to kind of resolve the situation.
Okay, so it wasn't a big
but in this
deal,
case, it was a little more serious
Oh.
because it was in the femur, which is like with humans, it's between the knee and the hip. And we took some x-rays, and gosh, it looked like on the x-ray that something was eating the bone. And of course, occasionally we see bone cancer, but I just can't believe a dog 3 years of age would have bone cancer. But I guess I knew deep down I was just trying to hope that it wasn't something for such a young dog. They go on for 3 more years past our normal 4 years of schooling, and I sent the x-rays, and they agreed that it was most likely a bone cancer. And so I told the folks, and of course they were upset, and they just couldn't believe at a young age, and I said, yes, this is very, very unusual. A good thing, but I just said there are veterinary oncologists, and I just think you need to go talk to them and see what options are available. Usually, in most cases, we're at the point in veterinary medicine that we usually amputate the leg, and it just makes the pet a lot more comfortable just getting that leg off. I know it sounds horrible, but dogs and cats are so resilient. It's just amazing. They don't care,
Mm-hmm.
They can still get around on 3 legs.
3-legged or whatnot, and they're just as happy as ever.